child. I want to go over to a statistics, and this comes from the New York State Division of Criminal Justice Services. Now, this link is on my website. Also, everything we're discussing today is comprehensive and complete on the website. So if you go to the show topics, click show topics, then go to calendar 2006, go to month of April. The site will open up, the page will open up to the information that we're speaking about now. Comprehensive, and this comes from New York State Division of Criminal Justice Services. The statistics show that 34% of parents in the United States do not know their child's exact height, weight, and eye color. What does that say? What's the message? To me, that's saying that we're not spending quality time with our children. My parents knew everything about me. They know the moles on my body. They know the skin tags on my body. They know my height and color when I was growing up. If 34%, so let's say out of 100 parents, 100 family, only 34 of them will know their parents. Well, will know their children. Will know their children. What is that telling you? That's pretty significant. That's embarrassing.
Yeah.
That means we're not spending quality time with our children. That is lacking, the quality time.
Concerned quality time,
Yes.
you know, because some parents have, that's why I spend good time with my children. We watch television, we go to movies together. But then we're talking about concerned quality time, meaning I want to be now concerned, not on having a fellowship with you, but your safety.
Right.
Yeah.
Again, it's a comprehensive approach.
Yeah.
Sitting down and having a quick meal, not having a conversation at the dinner, because that was my dinner table.
Right.
How was your day? What's going on? Any problems? Can we help? That was the communication. That's important. That's that family unit.
Right.
Today, go home, Game Boy, PlayStation, and that's not having a conversation. I mean, yes, you might be right next to your child, but you're actually communicating with them.
Right.
Communication is vital in any relationship. We say that is the core basic foundation, communication. Now, the next, I'd like to cover what are our roles as professionals and as community members.
Right.
Now, what, as a minister, as a bishop, what is your role, and how does that tie in with our topic?
Well, my role as a pastor is to be concerned, and not just to preach to them, but to be concerned about their whereabouts and whether or not when they come to church, I look at my teenagers to see from Sunday to Sunday, are they having an attitude and is something wrong, and I will approach them, is something wrong today, you're different. Their participation in the church, right. Sometimes their participation in the church is excellent, and then sometimes it drops off. Right. Their attendance also alerts me to the fact is, why are they not in church? Where are they at this time? And it allows me also to trigger the parents, because sometimes the parents are overwhelmed, right. 2 jobs and maybe a husband or wife problem, and the children are falling through the cracks. So as a pastor, I have to be a little more concerned beyond just preaching the word to them.
Right, exactly. You can notice that if there's a personality change, their body language, like you said, they show up, they're on time, and all of a sudden they become tardy, and then they're absent, they're not involved, they start to drop off from all the community events, and they're not proactive and involved. That's telling you that something wrong. That's a communication.
What about you as a physician?
Right. Well, again, I'm going to go from a physician's perspective, and then what we do together, because again, we work together as a team. As a physician, my job is not only to be the physician. I'm also a detective, because I have to detect pathology and problems, but I'm also a counselor. So I will sit down, a patient will come in, I will notice these things that you notice as well, and then I will address them. Basically, I will go over certain information, especially guidance, and like with this particular topic of Operation Safe Child, if I have a pediatric patient that comes in, I will bring him in with the parent, and I will sit him down, and we're going to go over the core basic tools, the needs, and we're going to discuss this a little bit further in detail a little bit later. But basically, they will come in with the parent, and I will discuss certain areas of the body, what we call special areas, and I will make sure that the child knows that no one is allowed to touch those special areas. And then if they do, how to handle it. Very important. Besides the education, you need to know what to do. If this happens, you must do this. And these are the tools. You must educate and offer those tools. If you don't have the tools, or the mechanism, and then the tools, and what to do, we need to that's the package, that complete package of the education. This is what happened. This is a problem. How we're going to handle it. That's the resources, and this is what this is all about. So getting into exactly what I do is, let's say I educate the patient that there's special areas in the body no one's allowed to touch. And then I make
children.
This is the children, and I say this in front of the parent, so the parent knows, that reinforces, because the parent usually mirrors what I say, and usually the parent, if they are proactive, have already told their child this, and then I'm reinforcing what they say. And then I will give examples of what someone can and cannot do. Like I say, if someone's going to touch those special areas, it would have to be a physician with the parent
consent.
With the parent consent. The parent has to be there in the room. And I explained that if anyone outside, like in the classroom, the gymnasium, the cafeteria,
A counselor or something.
yes, that it's inappropriate and how to handle
Even
it.
a gym teacher.
Yeah, exactly. Someone outside the family, and even family members, it should be just the parent, and explaining what's going on and why, like if there was a problem, like say an infection or something. But then again, if the physician's there, the parent has to be there, so we have a chaperone in a room. So that's just one example. Another example would be that if there was, again, if there is a predator in the neighborhood, and typically these predators will hang around schools, nurseries. They will hang around streets like the parks, locations with a lot of children, and they will prey on the weakness. And there are techniques that they use to soften up the children, to bring them over. And again, we have to teach them, what are they doing? How are they using them? They're using their softness. They're using the child's emotions to work against them. And this is something that we have to teach and address and say, this is appropriate, this is inappropriate. And part of education is using the proper language. You have to speak at the level of your audience, meaning knowing if your child is at 5 years old, you have to speak to them that a 5-year-old can comprehend. And that means not comprehensive, long, complete sentences. Is going to be short. Keep their attention span, and then that means you need to short and frequent conversations so they really start to absorb this material. Very important.
Are there certain basics that a child is supposed to know? The basic rules of safety early on, when a child may be 4 or 5 years old and whatnot like that. And I know when I came up, my parents used to say, you better know the telephone number, you know?
Right.
And I feel that as long as they are able to articulate, there are some basic rules of safety that are up on the screen at this time, and maybe we ought to look at those.
Right. There are some core basic rules of safety, and you'll see them on the screen. And as soon as you're able to educate your child, again, you need to know the level of comprehension that your child's able to understand. But at the bare minimum, your child needs to know his and her name, their address, and how to write them. It's the written and spoken language, and we need to educate our children. So
in other words, if a child is in the store and is lost, and you go up to the child and say, "What's your name?" Some of them says, "I don't know," or "I don't know your last name."
Right.
And "What's your address?" "I don't know." It's almost impossible for you to help that child.
Exactly.
So the basic thing is what? Name and address.
Exactly.
And show them how to write it. If we teach them ABCs, they should know how to write their address. Am I correct?
Their name. Absolutely. Also, if English is a secondary language, then you need to educate them in their primary language. Another suggestion is, if they're not able to comprehend, put it on an index card, and it should be on them. Again, I know they have tags. A lot of the parents used to sew their names in their
tag
shirts.
The clothing.
Right,
Sure.
tag the clothing.
That's okay.
That's very important. That's part of, again, that's that commitment that you made to your child. Just because you had a child, you're a parent. No.